Our organisation is called MESH, an anagram for Medical and Educational Sustainable Community Help. The name arose from an organisational need to facilitate projects which reflected our long-term ideas on overseas aid. In short, doing things for people is great. Teaching them how to do it is better. Respecting people by working or meshing with existing local systems shows you trust them. They feel more comfortable, learn new ideas faster, and continuity is more certain. The ability to impact on the two key areas of health and education brings enormous benefits. This video is of the medical side of the trip. We went to DaLat, Vietnam for the first time in 2009. This year we were certainly better equipped both mentally and materially. We left Australia with 19 bags of equipment and enough money to cover the family's hospital costs. Most of our gear was donated or loaned, and some, like this infusion pump, we bought in Vietnam for a third of the Australian price. Equipment handover is a bit like Christmas, except sometimes the wires got a bit confused or Sandy got bored. She said she was just following local practice and then tried to make up for it by telling jokes. Getting the trust of Dr. He, Director of Lam Dung Hospital, has made our trips to DaLat much easier and much less dependent on David and Hui, our coordinators last year. As the most fluent English-speaking doctor in the hospital, Kung's job is to coordinate between us and the local planning committee. I think he's brilliant. My interpreter, Lily, continues to make an enormous contribution. She moves freely between speaking with poorly educated ethnic minority parents to hospital administrators, and she is loved and trusted by all of them. Tien is the Director of Paediatrics and the overall coordinator of the trip. I've never seen him ruffled. A week before we arrive, he emails us a list of patients, including their likely diagnosis. Given the local geography and communication issues, I've no idea how he does this. The families gradually turn up, sometimes from tiny villages 8 hours or more away. Word of mouth means more drop in, so the list gets longer. Sometimes the local surgeons dropped in. The Vietnamese approach to informed consent is something like, "Okay, your child's got a hernia. Do you want to fix it? Yes, no. Okay? Yes. You said everything's okay with you. Bye." The handouts on surgical conditions Lily and I had prepared really helped. But since my Vietnamese is pathetic, information and questions always pass twice. Now, we saw 105 children and their families, so add in a bit of discussion with nursing staff and visits by Kung and others, it takes a long time, even to ensure we at least answered some parental and child questions. It took a lot of patience by all involved, especially the local staff. After they saw me, they went across the corridor for their anaesthetic assessment. Sandy moved between both rooms, providing a much-needed continuity. Dr. Hung, the chief anaesthetist, dropped in, but mostly it was Hui and Peter. Unlike Lily, this was Hui's first time as a medical interpreter. Her initial shyness gradually dissolved and she picked up medical concepts really quickly. After screening, the job of collating everyone's bits of paper, including all the add-ons, and agreeing on who was going to get surgery was a feat in itself. 28. We don't know how Tien coped with this, but sometimes I didn't. As in Australia, you ask yourself a few questions like, is there enough time? This is Vietnamese for in your dreams. Also, is there enough staff? What was that? Well, one Monday, one of the nurses got married, so theatre closed for the morning and we all went to the wedding. Same, but wildly different. We eventually operated on 47 of the 105 children, including 6 major genital reconstructions. Better screening at local hospital level would avoid families making an unnecessary trip to DaLat and help us to prepare better. This girl has a huge cyst on her chest wall. It would have been pretty simple to treat by an injection, if only we'd known to bring it. We knew from Lena, one of the interpreters for the education group, that people in her village, an ethnic minority at Langbian Mountain, had poor access to doctors. We were aware that this is a complex political situation. However, since screening only takes a few days, we asked Dr. He if we could bring experienced Newcastle GPs to both screen and provide primary health care in the village. Amazingly, he agreed to organise for the local police to permit the impossible, and in 2011 we will have better screening and better care for Lena's village. We think sharing both experiences and difficulties is a great way to learn. Everyone taught and listened. I worked with 4 of the local surgeons. Sometimes we'd go through a Vietnamese anatomy book to explain what had happened or what we were going to do. I was really impressed by the fact that they kept asking questions until we got it straight. The nurses are used to being first assistant and were always wanting to get into the action. After a while they made Sandy an observer and she gracefully accepted. And then they booted the surgeons out. With so much sharing going on, sometimes it got a bit noisy. I'd been a bit worried I was kidding myself about sustainable skills last year, but the mesh formula works. The local surgeons had been continuing to do the procedures we'd taught last year. When we increased the complexity, they occasionally asked for help, but by and large they were working independently. Having parents present at induction was now absolutely routine, a practice that last year hadn't even been considered and is still not done in major teaching hospitals in Ho Chi Minh City. We treated this girl's burns last year, but honestly what we could do surgically was a drop in the bucket. We elected to try pressure garments, and an Australian sports clothes manufacturer has sponsored these. Theatre finishes at 4:30, but we were often there much later than that. Sometimes I'd take a quick nap. Unkind people would say it had something to do with rice wine. Post-operative ward rounds are fascinating. There's no such thing as privacy, and everyone, including people wandering around the corridor, gathers round to hear what's being said, even if their child had a completely different procedure. No one seemed to mind. There are many people to thank. First and foremost, we'd like to thank the children, the gentle, the bright, the cheeky, the courageous, the entertaining, and the cute. We'd like to thank Tien and Sing, affectionately known as Mother, the hospital doc who was such a great help with the kids here standing guard in recovery, the iced coffee that always arrived when you needed it, Peter for practicing important phrases like "Where's the disabled dog's toilet?" and all our sponsors, present and past. Dr. He clearly sees the potential of this project, and his current priorities are to expand skills in orthopaedics, laparoscopy and biomed technology. The Vietnamese are a passionate and resilient people, often living in substandard accommodation in rural communities, drying their rice by the side of the road and dealing with an impossibly complex infrastructure.
You go away. Yeah. When you go away here, you live here one symbol.
One symbol?
Yes.
Yes?
Well, I call John Shippo. Every time when you say okay, yes.
Yeah.
A lot of people imitate you.
We've made friends and a promising start in DaLat, and we'd like to keep going.